We're funded by the John A. Hartford Foundation, and our work is based on improving quality of life for people who live and work in nursing homes. It's based on the NASEM report that some of you, hopefully all of you maybe by now, have at least reviewed, a big 600-page report, but we've culled recommendations and we've created 9 action plans. And you're going to be hearing today about some of the tremendous work by a particular state on some of those action plans as they are moving forward themselves. So I'm just going to very briefly review a couple of the things that have been going on recently. And I'm joined today by Isaac Longobardi, our director of Moving Forward, and Sumeri Maki, who is our program manager. And they can chime in at any time as they often do. But in terms of recent conferences, some of you we have seen recently at conferences like American Healthcare Association and Leading Age. I know last week Isaac was at an HMAC, a mortgage lenders conference in Bethesda. We were at the Consumer Voice Conference in Baltimore, Maryland last month. And just last week, a number of us were at the Gerontological Society of America conference in Tampa, Florida. And at all these conferences, we get to network, we tell people about the coalition, and most importantly, we hear from you. We hear about the work you are all doing in your different states and regions. We've also had a number of publications by different coalition members recently, including in the New England Journal of Medicine, Caring for the Ages, and a number of other ways that we reach people and tell them about work that's related to quality of life for nursing home residents. We also have had a lot of talk with state leaders. Again, you're going to hear some of them today, but we've spoken to leaders in Maryland, in Michigan, Pennsylvania, and a number of other states. So we want all of you to know that we are reaching out and trying to build infrastructure so that the work of Moving Forward does continue. And to do that, we need to have state and local engagement. And so we're really grateful for having that. Another timely issue to just mention is that on the federal level, there was a final rule that came out actually just yesterday about nursing home ownership, transparency, and reporting of ownership data. And that's work that the Moving Forward Coalition has been following very closely, and we work with the Center for Program Integrity and other groups at the national and also the state level. So just if you haven't seen that final rule, we can certainly share that with people, and happy to add about what we're doing. There's also another final rule where the comment period ended on November 6th that you may be familiar with. That was CMS's final rule related to nursing home staffing. And so some of you may have submitted comments on that, and CMS will believe they received something like 50,000 comments. So they'll be reviewing those. It'll take a bit of time. So with that, I just wanted to turn it over to Sumeri, who will briefly share with you about work in the state of New Jersey on resident councils, and also some work in the state of Michigan. So Sumeri, over to you.
Thank you, Alice. So Alice, as Alice mentioned, we really want strong state partnerships so that actionable change happens and that our action plans reach a more local level. And the Michigan team has been one of the state teams to take this on. They started to convene earlier this summer and have already built such a strong and diverse group of advocates, providers, QI and QIOs, researchers, ombudsmen, et cetera, many of whom I actually think are on this call today. And of course, we can't forget Michelle Mochia and Belinda Dovic, who lead this effort as well. And our main goal with this state team has been to build this partnership across these stakeholders. And in doing so, we've actually taken on a project to support the national committee working on addressing resident goals, preferences, and priorities, that action plan, and have really been making great progress on that. And I know we have some really exciting news related to Michigan as well, and we'll pass it back to you, Alice, to share a little bit more about that.
All right, thank you. So yes, Michelle Mosia is on the call. She chatted in, so thanks. And we want to recognize her for work that she was doing well before we got involved. But building on Michelle's work, Belinda's work, and others, we're happy to announce that we just heard within the last couple of weeks, we were funded from the Michigan Health Endowment Fund under their Healthy Aging Grant portfolio for about $500,000 over 2 years to specifically look at leadership and quality improvement efforts in about 5 nursing homes, working with that Michigan State team. So we've got some national experts involved. We're building out and strengthening the efforts in Michigan, which are tremendous, and we're really excited about this new effort. So thanks for that. Thanks for highlighting that, Sumeri. And now, Sumeri, do you want to talk about the New Jersey resident councils as our last item, I think?
Sure. So as we've been continuing to talk about strong state partnerships, we're really excited to share that the action plan on resident councils, we have decided to partner with our New Jersey colleagues, including the New Jersey Long-Term Care Ombudsman Program, to pilot that resident council guide that we talk about in our action plan with 4 to 5 nursing homes in that state. So we're excited to share more to come, and we're excited to share those updates in our future coalition conversations.
Right.
Back to you, Alice.
Great. And many thanks to those of you on this call who have actually given us feedback on the guide to how to run a resident council, how to guide a resident council. And we're working very closely with a number of nursing home residents themselves, because they are the ones who need to direct and should be directing resident councils. So we're grateful for all of that. Also, to any of our colleagues on the call from Pennsylvania, we also have a Pennsylvania state team, and they're just starting to do more with workforce, with community colleges. Isaac and I were just on the phone with them this morning. So that is a quick soup to nuts, and we didn't touch on everything, but those are some of the highlights that many of you have been involved with. And Isaac, Sumeri, and I would just encourage you, please chat in if you would like to. Anything that you're doing related to moving forward or nursing home quality, we'd love for that peer-to-peer sharing to continue. So with that, we'd like to introduce our guest speakers for today, who are going to talk more about the Ohio State Task Force and their outcomes. And they're going to share those experiences and, what they're doing coming up, and also what other states can do. So I'd like to introduce both of our speakers. So Director Ursel McElroy, she was appointed by Governor Mike DeWine in January of 2019 to direct the Ohio Department on Aging and to administer the state plan on aging. She represents the interests of older adults in Ohio's executive branch of government, oversees coordination of long-term services and supports that's funded by the Older Americans Act, Medicaid, and other federal, state, and local dollars. So she has over 30 years of experience in local and state government. And then she's joined by Dr. Jessica Coleman, who's a certified medical director and board certified in geriatrics and family medicine. Dr. Coleman serves as medical director at multiple nursing homes and assisted living residences. She is board president of the Ohio Society for Post-Acute and Long-Term Care, and also serves as regional medical director for the Ohio Department of Aging's Rapid Response and Assistance Program. I could go on, but we want to get to their presentation. So with that, Director McElroy, I think we will turn it over to you. And thanks so much for being here with us today.
Absolutely, absolutely. Thank you, Alice. Thank you, Isaac. Thank you, Sumeri. And thank you to the entire Moving Forward Coalition for inviting Ohio. And I'm happy to hear about the great work that's taking place in some of our neighboring states. But I would say, watch out, Ohio is here today. And we have some good things and exciting things that we want to share with you. And so first, I think it's really important to contextualize today's discussion. I will offer some relevant facts and perspectives about nursing home care in Ohio. At the highest level of our executive branch within our state, we have publicly prioritized our commitment to improving the quality of life of older Ohioans, including the many living within our nursing homes. A few things to note, and you'll see on our screen, is that our population, 65 and older, requiring nursing facility-based level of care is growing within our state. And we do expect there to be some significant increases as we move towards 2030. We also know that COVID-19 heightened the need to address resident needs and our workforce shortages within the nursing homes in Ohio, and we know that to be true across the country. And with that, the Ohio Governor's Nursing Home Quality and Accountability Task Force was created. It was done so by an executive order on February 24th of this year. So a bit more about our nursing homes and our nursing home landscape. At the time, Ohio reported approximately 950 licensed nursing homes. So that makes us third highest nationally. And that translates into approximately 86,500 number of licensed beds. So as you can see, we have a pretty large and diverse group of nursing homes across our state. Now, between 2018 and 2022, however, Ohio declined in its overall nursing facility CMS star ratings. With a 3.3 average star rating in 2018, we were the same as the national average. But we've now moved to a 3.0 average star rating, and that was in 2022, slightly lower than the national average of 3.1. So what that meant is 40% or 382 facilities have seen a decline, and that's depicted within the figures in front of you. Now, when you look at Ohio overall in comparison to a couple of different cohorts, on the next slide, you'll see that we have a lower percentage of nursing homes with high overall star ratings. So on the first side, you'll see that when we're compared to those states within our region 5, and the same holds true to states in the top quintile of percentage of state nursing homes with 4 or 5 stars that also have more than 300 total nursing homes. So again, we wanted to see how we were doing as a state, but how do we compare to groups that are most relevant within this exercise? We also learned that Ohio has a yo-yo compliance concern. When we talk about yo-yo compliance, it's considered to be a repeat health deficiency of the same F tag of scope and severity of a D or higher within 1 year at any given facility. So we will see something happen, there will be some correction that takes place, and what we observe is that those corrections are not necessarily sustained. Now, this is a problem when you have so much inconsistency within the system, because these inconsistencies are felt and experienced by the residents, the families, and the staff. 54% of our facilities were wrestling with this issue of this up-down sort of dynamic. One thing I do want to note, because I'm sure it's a question that you might have, is that infection control was not considered due to the outlier impact of COVID-19. So when I talk about this up-down sort of dynamic that we had, it did not include, or when we looked at this, this was not even including the infection control. So at a glance, we begin to see a picture or a narrative form, one that suggests that in many spaces, we do have inconsistent levels of quality within some of our nursing homes and also throughout the nursing home system. But what we also know is that we have a lot of dedication and a lot of commitment. And I believe that is indicated by the volume that we have and the enthusiasm that we've had from the nursing home industry to continue to participate in our efforts for improvement. So this was the challenge. The challenge that was presented, right? It was simply, it's interesting, if you understood sort of how our administration works and understood our leadership team, you'd understand why this particular slide is quite, while funny, but really reflective of some of the challenges that we've taken on. How do we evolve our nursing home ecosystem is really what it comes down to. We certainly understand that what we're seeing is larger than the physical plant of the nursing home or the site of care, but it is more reflective of an entire system. And how can we ensure that our system is operating in a way that there is consistent quality, not only within a particular facility or home, but across all of the homes within our state? So the question for us was, how do we strategically, thoughtfully address this in an inclusive, timely, and transparent way? And interestingly, about the executive order that was put in place, the executive order said, listen, there's some things that we want resolved, we want transformation. We formed it February 24th, and we want a report on the governor's desk by May 26th of the same year. So we were working with a 3-month clip to do this. So we first organized as a task force and had to agree upon what is our North Star? What will continually orient us? What will we use as our frame of reference? What are we striving to achieve? Well, the first was quality of life. We wanted to ensure that life for older Ohioans remains person-centered, meaningful, and connected to their families and communities. We wanted to also have high quality of care to enable Ohio to achieve the desired health outcomes through the care delivered. We wanted a focus on resident rights. How can we ensure that we are continually protecting and promoting residents' rights so that we can ensure the dignity and independence of all of our residents are maintained? And then finally, system performance, aiming for continuous improvements to the system in a way that is thoughtful, strategic, and deliberate. And that would require us to have bi-directional feedback throughout our system. So we believe we can do this. We believe that we can create a best-in-class system. And to do this, there are 4 things that we're focused on. 1 is enabling excellence, to build capabilities and resourcing in our nursing homes to deliver high quality care. Our aspiration is to go from being reactive in the support that we provide to be more proactive in the support that we provide. We also want to be certain that we are able to ensure oversight and accountability so that no Ohioan is at risk in a nursing home that is out of compliance. So moving from a system that is very nursing home agnostic, no matter the nursing home, the way that we provide oversight and accountability is pretty much the same. But how can we do it in a way that is more targeted, more specific, that provides that particular home the things that they need so that they can thrive? We also need a system that empowers residents, that understands that everything we do must elevate the voice of the residents in their own life experience. And so right now, our system, while we have some feedback, it is limited at best. And how can we be very intentional to be certain that everything we put forward is resident-centric? And then finally, making certain that we have a system that facilitates data-backed decisions. We need to have the data to make informed decisions and decisions that can be made in a timely manner. Going from having disparate data sets and information that is quite cumbersome to a way that is designed and laid out can be insight generating. And to do these things, we also put in place our cross-cutting lenses. Those things that we must also consider with our work. So while we strive to have data-backed decision-making, while we work very hard to ensure that we are empowering the residents' voices, that we are making certain that we have the right oversight and accountability, to be certain that we are enabling excellence, we must also, in all of those things, consider our critical access facilities, make sure that we are focused on equity, workforce resiliency, and elder justice. Next slide, please. So our nursing home ecosystem is really important. And while there are some things on here, admittedly, there are others that certainly can and should be added. But the idea behind this is to underscore the point that I raised earlier, that in order for us to be successful with the plan that we are moving forward with, we have to contemplate how each member of this ecosystem plays into this solution. And so we had what we believe is a really comprehensive approach to this. We understood that our approach had to be just as comprehensive as the solutions that we were seeking. And we embarked on a 3-month sprint that I want to share a little bit of detail with you about, and then tell you where that has left us right now. First, we had to examine some of our foundational work that we had already done within our state action plan on aging, our state plan on aging, and some of the research on nursing home quality. What could we learn from those things to help jumpstart what we were attempting to do? We also wanted to host listening sessions across the state, and these listening sessions were very much designed to be able to hear the voices of those that oftentimes we really don't hear from: the families, the residents, the staff that work in the buildings. These listening sessions were designed so that we can understand what's most important to you. What is your experience like, and what would you like to see us do? We had task force meetings. Our task force meetings were every single week, 10 a.m. to 3 p.m., February through May. And we've continued those now on a monthly basis. And then we sought expert input in particular areas. So we had 12 in-person sessions, 3 virtual sessions. We stood up a call center so that we could take calls, so that we could answer questions people might have. And we also had an online survey. And I do want to, for a moment, pause here to say that much of this work was very possible. And a lot of the feedback we got was because we had the support and the help of the facilities and the long-term care ombudsman. They were instrumental in being certain that we were able to connect with individuals, that we were able to have people show up at the listening sessions. Many of the sessions had 100 plus individuals who would come and share some of their most intimate stories with us. We were determined to be able to hear from as many people as possible, and to be able to assure them that their feedback would be the gift that kept giving. Not only did we want their information at that moment, but their information would continue to help inform how we move forward with some of these recommendations. But there were some themes. I'll list a few here, and then you'll see more on the next page if we can go back just for a moment. Some of the themes we saw: that quality is a spectrum, and the high end must be defined and supported with a competent and compassionate workforce. We also heard again and again that federal regulation mandates the minimum quality standard, and at times that's not being enforced. Our systems are not designed to empower residents and families, and they do not believe they are being heard, and that there is a lot of information out there, but it is not available in plain language and in a way that is helpful to many families. And so on this next slide, you will see there are many themes across listening sessions. In our listening sessions, we wanted to understand first, what is the experience around selection and admission? What is that process like when you have to decide where you will go for your care? And then what does that subsequent admission process look like when you've made that decision? We wanted to understand, what is your experience once you arrive? What is it like for you? And then when there are transitions of care, how has that been? What has your interaction been like when you have to engage with the state, when you reach out and you need the support of the ombudsman, the surveyors, when you have questions that need to be answered? What is that experience like? And everywhere we went, it was rich with information that allowed us to formulate themes that again helped us in the design of our next steps. And so you will see within our report. This is our recommendations report. And I want to say a few words about the report and why we were very thoughtful about its design and the timing of its release. We hit our target of May 26, 2023. And that was because we had very dedicated, committed individuals to do so in this really compressed period of time. I would invite you at this moment to actually, with your phones, we have a QR code up here. If you're curious to see what's in the report as I'm talking, you can certainly pull it up and review it. But the report is concise. It is to the point. It is packed with action. It is easy to understand. Anyone can pick it up. And it is compelling because throughout, we are able to integrate the voices of those individuals within the listening sessions, from the surveys that wrote letters, that spoke with our ombudsman. It is a document full of rich information that makes it very clear what our North Star is, what we intend to do, and the immediate steps that we can take. It is a document that easily holds us accountable for the next things we are to do. And the other thing I want to note is that the document also was released in a timely fashion. And I'll say a bit more about that here momentarily. But for a moment, let's walk through what some of the things are within the report. We kept the report aligned with those four things that I earlier laid out to you: enabling quality excellence, making certain that we were ensuring oversight and accountability, empowering residents, and facilitating data-backed decision. And you can see we want to be certain that we're developing a quality strategy, that we're ensuring payment models are in place to provide sufficient resources to support the high quality that we desire. We want to be able to incentivize nursing homes. We want to provide targeted clinical and technical assistance. And we want to recognize nursing homes that improve quality significantly or exceed the new standard that we will set for excellent quality of care and quality of life. And we also want to enable workforce excellence. We want to build new and strengthen existing community partnerships that we have in place to grow our clinical workforce. We will fund, test, and deploy technology and additional training to increase the efficacy and efficiency of those critical roles right now. We want to articulate the value of being a frontline worker. We want to align occupational naming conventions. Within our state, we believe we're the only ones who still refer to our certified nurse aides as state-tested nurse aides. We want to ensure oversight and accountability. We want to expand the staff so that we have enough surveyors to do the things that people expect our survey staff to do. We want to develop more efficient and effective nursing home oversight processes with standardized training and technology support. We want to tailor our processes. We want to use the full spectrum of remedies available right now to us. But we also want to create intermediate enforcement remedies for our licensure process. And we want to build a transparent, best-in-class complaint platform. Over and over again, people said, we don't know what happens when we submit a complaint. We don't understand why when a complaint is made, that things don't seem to change. And so being able to provide transparency that is allowable within that system. We want to empower our residents. We want to provide accessible advanced care planning materials. We want to provide accessible and simple information upon nursing home admission and throughout their journey within the nursing home. We want to empower nursing home residents to freely assemble as a council and to have the voices of those councils elevated. We want to educate consumers on the role of the long-term care ombudsman. Repeatedly, people said when we knew about them, they were very useful and helpful, but so many people did not know about them. We want to expand staff and standardize operations and training within our ombudsman program, with a particular emphasis on those individuals that may not necessarily have someone to advocate for them or to reach out to the ombudsman. And then finally, facilitating data-backed decisions. Building an accessible, understandable, public-facing portal so that people can easily understand what their choices are before them. We know there's a lot of information out there, but again and again, it's not presented in the way that has been most useful for many families and residents. And then we also want to build accessible, informative, and visual dashboards to support our state leaders' decisions. In other words, we want to move from a place where we just collect data to a place where we actually can use the data to be predictive and then ultimately even perhaps prescriptive. Next. So with all these things, time was running out, but we're very thoughtful about time and we respect time. We respect the window of opportunity. We respect the fact that there is someone always on the other side who needs us to move with a bit of urgency. We understand that we have to do things in a very timely and strategic way. And so with this report being delivered May 26th, we in Ohio were right in the midst of our state operating budget process of 24-25. And while we understood we had these grand plans of things we wanted to do, we also knew that we had to couple that with resources. We had to balance those things that we want with being able to resource it so that we could get it. And so during this budget process, we were able to, with running very fast with our report, to say, hey, there are some things. And while we certainly want to be sure that we are adequately funding our nursing homes, there are some things that we also expect to receive with that funding. And I want to talk here about a few of those historic investments that we've been able to make in quality because of the work that we've done. The budget invests in nursing home quality and positions Ohio as a leader in the nation in investments. We were able to increase our fining authority, increase our number of state inspectors, increase our number of nursing home advocates. We will now have a new state-funded clinical training program, launching our online dashboards. We will be one of the first states in the country to pay more for residents to have their own private rooms. We will increase funding in the quality formula. We have added metrics to the quality formula, such as staffing hours. We have many budget investments. We had $1.4 billion in new nursing home funding. The legislature appropriated a historic 23% rate increase for our nursing homes to support staff wage demands. We have, in our constant work with the legislature, been able to also demonstrate why what we've done as a task force will not only need that initial funding, but sustained funding to have the true changes that we desire. And for anyone who's interested, certainly we can share in more detail how we were able to do those things and what some of those things more specifically look like. So what you see in front of you now are the action plans and task force recommendations. Timing, as I said, is always wonderful. And that's why when the Moving Forward Coalition came out, it was so amazing, the timing. And so we looked at the action plans and we compared them with our task force recommendations to see where can we leverage the work of the coalition with the work that we're doing as a task force. And as you can see, pretty much everything lines up. And the strategy, as you can see here, there's one, I think in particular around financing household models and physical plan improvements. Well, we were able to do some of those things even within our budget. But it's really important that we are leveraging what already exists, this side by side. We've done that deep work and we continue to follow the plans from the coalition. So what do we need of our task force members now? And why do we think this is working? Well, first, we understand that we all have to lean into the tension provided by the different roles and perspectives, asking why to find middle ground. It was really important for everyone to understand that there will be some tension. There will be different viewpoints, and we invite and encourage those. But when we begin to ask why, when we begin to do the hard work, when we begin to accept that there are some opportunities for improvement, when we continue to remember our North Star, is easy to get to middle ground. We also understand that we have to be accountable to each other, maintaining and supporting a high bar for success. Again and again, asking each other, checking in on each other, making clear what the expectations are to one another, and then identifying the path to yes, rather than stopping at barriers to progress. You can certainly raise an issue as a task force member. We encourage that, but then we're also looking for its companion, perhaps next step or solution. Right now, we've set ourselves up with major deliverables by work streams. The work streams will happen over the next 6 months. But right now, I'm going to show you the first 3 months. And then Dr. Coleman is going to talk to you about some of the work that we're doing right now as an example with technical assistance. If you want people to follow you, if you want people to lift your cause, they have to see themselves within it. In addition to that, they have to see a clear path of what you intend to do. And that's what we're attempting to do with our work streams. Right now, we have shared with the task force members, as I'm sharing with you, what we intend to do over a 3-month period. When you look at Q4 of 2023, you will see our quality, our technical assistance, our ombudsman, and our dashboard. Right now, we are looking to have our KPIs, our key performance indicators across all streams. What can we all agree upon? What are going to be those things that we can measure our progress against now and down the road? Within these work streams, we have also identified work stream leaders. We have also defined a cadence of check-ins with these teams. Each week, there is a meeting, there is a check-in, and there's an expectation of deliverables, some of which you can see before you. We also understand that we have an obligation to demonstrate our return on investment to our legislature and to the people. The people want to know that what we're doing matters and that it works. And so we are satisfying multiple audiences to be able not only to lift up this work, but to be certain that we have continued support to sustain this work. On this particular slide with the work streams, note that we also have a subsequent one that's already been developed. It's not on a slide here today, but it already lays out what we will be doing in the next 3 months for Q1 of 2024. So some of the things that you might not see on here, it doesn't mean they're not underway. It simply means that maybe they're not part of a primary work stream, or that the preliminary work is happening in anticipation of them being a primary focus for 2024 in our first quarter. So technical assistance, Dr. Coleman certainly leads much of our work in this area. And I wanted to highlight an example around enabling excellence and what we're trying to move from and move to. And Dr. Coleman will talk to you about our work with our RAP program, our quality improvement program, and how that's going. Dr. Coleman.
Thank you, Director McElroy. Before I go into RAP, I want to highlight a couple points that the director made today. I know a big part of this call is learning about how to replicate similar programs in other states. And I think in replicating this program, you need to find a way to, number one, find a leader and bottle that enthusiasm and that passion that the director brought to this project. Without that, we wouldn't have even gotten off the ground with any of this. And it's really been amazing how much the group has been able to accomplish in a small period of time. Thank you to the director for being that leader and that passionate person. I also want to underline the point that the task force is made up of leaders from across the state, leaders who have already been stressed to do the job of 5 people in one at minimum. And there are some people on this call who are on that task force who would probably say 5. I do the work of 10 people on a daily basis, especially post-pandemic. But they took the time out to drive to Columbus from wherever they were in the state and spend a whole day every 2 weeks and then every month to dedicate their time, talent, and resources to this project. So I really just want to underscore the level of commitment that this took to get off and running. The next point I want to underscore, which leads into the program, the RAP program, the technical assistance program, is that sometimes we operate in a bubble and we take for granted that we are committed to improving the care of older adults in our community and in our state. Because everybody who I work with says that's what they want to do. And everybody on this call says that's what they want to do, but nobody knows how to operationalize it or make it happen. And that's where it comes down to the people management that the director mentioned, is finding a way to get these people together and to start to have those arguments about the goal is the same. I want quality of care for older adults in Ohio, but I may disagree with you on how we get there, and encouraging that tension and those disagreements, I think, is where the majority of the innovative thought and programs came out of this particular task force. So having said my appreciation and the importance of people management, let me tell you a little bit about the RAP program, which is evolving into the technical assistance column of the previous slide. So RAP started in December of 2020 in response to nursing homes not getting their fair share of resources and being neglected as they were across the United States, and not getting the help that they needed both clinically and infrastructure support wise. So it was an initial formation of medical directors across the state who came together under Dr. John Wigan, who's now the medical director of both the Ohio Department of Health and the Ohio Department of Aging. And we started making outreach calls to facilities who were reporting COVID outbreaks, and then helping with things like testing, PPE, clinical guidance, infection control and prevention, and then evolved into things like actually providing staff. Initially, we worked with the Ohio National Guard, and that's evolved into using private staffing agencies and other resources to help facilities in times of crisis. We have been very reactive. We reacted to the pandemic and we reacted to the outbreaks that were happening across the state. But in that reactive measure, we were able to collect data and gather information about what the homes were really struggling with, not only during times of pandemic, but now post-pandemic, and as people are rebuilding and trying to encourage recruitment and retention of staff and survive the survey process. How do we best help them? So we took that feedback and how we can best help them, and working within the task force to figure out how we can best be a technical assistance program. Moving forward, we have 3 main priorities for this program. The first is survey training and culture for long-term care leaders. The next is working on a critical access facility assistance. And when we say critical access, what we're talking about here is when you think about a critical access hospital, it's either a rural hospital that's way out there and nobody else can provide that level of health care because there's nobody else around, or maybe it's a more urban setting, but nobody else is providing that particular service. And we're taking that same lens and looking at nursing homes and saying, who are the ones that we really need to support, because maybe they're the only ones in this area that have a ventilator unit or in-house dialysis, or maybe they're just plain old, the only nursing home within the whole county. And we have areas like that in Ohio because we are such a diverse state, where we have super urban areas that have everything for everybody, but it doesn't always trickle down to the everybody that lives in nursing homes. And we have very rural communities that maybe there's only one hospital for 3 or 4 counties, or maybe there's only one nursing home for a large geographic radius. The third main goal is targeted quality measure, improvement, and support. And herein lies education, mentorship, measurement, and then providing that in a way that's sustainable. Right now, what our program looks like is it's made up of regional medical directors across the state. The state is broken up into 8 regions, and we split those up as medical directors. And we're supported by an incredible regional coordinator team, which is made up of nurses, physical therapists, others in the healthcare industry who have experience in the nursing home setting, who support us in that mission. This program also ran the call center that was integral to part of the task force efforts in fielding questions as we opened up it up publicly to get feedback for the task force, and now in reaching out to different facilities. We've been really lucky in the type of folks that we've been able to support and in the type of people we've been able to recruit within this program. The other hat that I wear is as the president of the board of the Ohio Medical Directors Association. It has a new name called the Ohio Society for Post-Acute and Long-Term Care. So if you hear OMDA, it's the same thing, the same people. We represent not only medical directors in the state of Ohio, but also practitioners in long-term care, PAs, NPs, and attending physicians. It's been a really important relationship building experience for us to work on the task force. We also, all of the members of the RAP program, the regional medical directors, are also members of the OMDA organization. So we've been able to pull from some national resources as we continue to build this program. The last point I would mention on RAP, moving into a technical assistance or TAP, we're into rhymes, is working on that proactive support, finding out what are the needs at the ground level and how do we support those needs, and moving forward with educational campaigns, survey preparedness, supporting those critical access facilities. I'll pause there for the director's final comments and then look forward to questions.
Yeah, so I think actually you can, if you move the slide, maybe a couple of slides now. I think I just want to close and open it up with our thoughts on, from my perspective, and I think it's true for the entire task force, is that a big part of this work to be successful, we believe in, its implementation and its sustainability, is constantly advocating for it in a very strategic and organized and thoughtful way. Communicating. It is really important for us to communicate and to be certain that we are creating a way for people to communicate with us, that this has to be a two-way thing. We cannot carry the water alone. As I mentioned before, this is an entire ecosystem. Everyone has to see themselves in this and has to have their voice heard in this, and then educate. There may be some things that people aren't aware of and don't know. I think we like to believe that everyone wants, I think as you're hearing Dr. Coleman say, everyone wants high quality care. We really want a really high quality of life, but just making certain that we are doing the work and creating those avenues for the advocacy, the communication, and the education is just as important as putting our heads down to come up with some of these solutions. So there's a whole machine that has to work to support this for this to be effective. So I think we will stop there in sharing some of our experience and just making clear that we still have a lot of work to go, but I look forward to our anniversary in May, where we'll be able to say within 1 year from the report, we've been able to do some really incredible things. And we want to begin to see some real changes in outcomes.
Fabulous. I can see everybody clapping, whether they're clapping like this or not, but you know, clearly the chat is very, very active, and you know, with some ideas for both of you. So thank you so much for all of that information. I know I chatted in one request to people just at the end here, which is if you heard anything during the presentations today that made you think, gosh, I wish we could do that where I'm working or in my organization or in our state, please chat that in, because you know, hopefully you learned at least one new thing from this tremendous effort. I'll just say from my perspective, again, like many of you, I've been in this field for a very long time, 40 years, and I've done regulatory work. I've worked for the state, I've worked for the federal government, I've been a nurse practitioner in clinical practice, and we've got lots of people on this call who are in different roles, advocates, QIOs, ombudsmen, and others. But to me, what really resonates when I hear Director McElroy talk and Dr. Coleman is the true integration, and it is very, very intentional And it doesn't just happen. It has to be people who have that vision and are thinking about needing to really integrate and be inclusive. And that's one of the places where I hope moving forward is aligned with that idea that we've been very intentional. We want nursing home residents at the table. We want to hear what they're saying. We want to act on it. We want advocates at the table. I see a number of advocacy organizations represented here today. So happy you're on this call. And nursing home owners and operators and front, workers, direct care workers and others. And again, I know we have a lot of those folks on the call. Kathy Bradley chatted in impressive progress in less than 1 year. Really, really impressive. And I think part of it is because you're bringing so many different groups together. I know there's been an active conversation about the Essential Caregivers Act. A few people chatted in a link that Carrie asked about that. And I don't know if either of our speakers, if you have any information on that you would want to share. It sounds like it's still kind of going through the legislative processes. Do you guys have anything to add about the Essential Caregivers Act in Ohio?
And I think if I'm correct with when I'm trying to get to the chat question, as it's making its way, is this in relation to being certain that someone can be present? And I want to make sure
Yeah,
so,
Carrie has her hand up and she's the one who asked the question. Carrie, do you want to clarify?
Mm-hmm.
Hello, sorry. So some states already have passed an essential caregiver law that will always guarantee a resident access to one or two essential support people if a facility was have to close for any reason. We had a federal bill that was introduced that has to be reintroduced that hasn't been heard yet. And, so I know Ohio had something going through.
Yes.
I don't know where it wound up, because what we know now about writing these bills and the laws versus what all of us at that time uneducated advocates knew when we started this is a whole big difference. So that was one of the questions I had is where were you at that?
No, I appreciate you raising the question. So I will say that we have, and I think there are a couple here on the line too, who perhaps have also been in discussions with the primary sponsors on this. So I know within my department in particular, my legislative liaison has been involved in those discussions and following things closely. I will say, we do have an appreciation for, and I think we have throughout, the need to have those connections. As you know, many of this came about because of what we experienced during COVID, and I think it was an incredible balancing act and what to do and what not to do. We tried in Ohio. I just want to make a point here that we tried really hard in Ohio, and I can say this with certainty because I was deeply involved with how we structured visitation during those times and having people available and working really closely or trying to work really closely with our nursing home associations and facilities. And we tried throughout to be as liberal as we could with the circumstances before us. And so I think what's happening now, I think we have more of that. And I know that we have legislators who are interested in making sure that we have certain things in place. And by the way, we have some things already in place here, but there's even more layers that are, I think, on the table right now. We just want to be certain that in doing these things, that we also have some discretion. So should the situation arise where we do have to still balance, the ability to have people come in and some of the safety. So I think it's a balance. It's a really fine balance.
And as an advocate and as of a mom of somebody who lives in a facility, that was the thing we were asking for was a balance. I never wanted to see anybody open the doors wide because that risked my son and every other person in his home. That's never what we've asked for. And that's why we've always offered to work with anybody. So if you don't have anybody in Ohio that has worked with any of us through the different components of working on essential caregivers laws. Myself, Connecticut, Texas, we all have really good, strong laws that worked well with public health, with the ombudsman and the facilities. Alice knows how to get hold of all of us. If not, she knows how to find me for sure. Alice, could we find a way to do this again and invite directors of public health and ombudsman from every state to come listen to these two wonderful women? We've got to fix the system. It's broken. We all know that.
Yes, Carrie,
And
thank you.
they're doing
Thank
this.
you. Yes, they are. And we have only 3 minutes left, so I just want to wrap up.
Go ahead.
I will connect with you offline for sure. I also just wanted to be sure to connect back with our speakers that Dr. Terry O'Malley, who lived in Boston for a long time, but now lives in Cleveland, Ohio. So he's in your state now. He wanted to be sure to be able to connect with you around some of the HIT committee work. And there's others who have chatted in also that they would love to connect with you or someone on your team who's doing this work with you. So please let us know if we can share your contact information or who you'd like us to put people in touch with. I think there's a lot of energy in the chat. There is just no question. And I'll echo what Carrie just said. We would love to keep this going and make sure that we can really get other states who can take this information and take the process that you put in place and that you did all this work in a short period of time. And it's about your leadership. We know that. But, how can we do that in other states? The people who are on this call they're volunteering their time. I mean, they're doing this on their own time largely. So, and I know people want to share the presentation if possible. So Isaac will connect with you on whether or not we can do that. Isaac or Sumeri, do you have any other comments or things you'd like to share before we wrap up the call here? And we'll do that by thanking our tremendous speakers. You guys were really sharing great information today. Sumeri, Isaac, thoughts from you guys?
So, again, thank you so much, Dr. Coleman and Director McElroy. We went into this call hoping to learn a lot from you as we do our work in some states, and Michigan and Pennsylvania and New Jersey and elsewhere. And I think we achieved that goal. And so many wonderful questions in the chat, so much amazing momentum, and we look forward to sharing what resources we can from you all and continuing this conversation. So thank you so much.
Sumeri?
And I would just echo our thank you for you both. Thank you. This was incredible.
All right. And I would just say one more time, anybody who has follow-up questions or anything that you'd like to know related to today's presentation and today's call, please reach out to either me, Isaac, or Sumeri. We will get back to you. We're gonna listen to the call and read through the chat again. So many thanks to both of you for joining us today. And thanks to everybody else who's on this call who's doing such great work. You guys are the Moving Forward Coalition. So we're very grateful that you joined today. So thanks everybody, and we'll talk to you again soon. Thanks very much.